Thank you for tuning in to Macroview Television and welcome to a brand new edition of Taiwan Outlook, the program that presents the different faces and lets you hear the different voices on Taiwan. I'm your host, Rui Guo. How much do you know about the country Bangladesh? And what are the programs available to help the people there? On today's program, we're delighted to have a conversation with Ms. Mayeesha Tseng,曾育慧, who's currently a PhD candidate in the Institute of Health Policy and Management at the National Taiwan University, to share with us her experiences traveling and working with the people in Bangladesh. Welcome to our program, Mayeesha.
Thank you, Raymond. It's nice to be here.
Well, it's a pleasure to have you on the program. First of all, would you please tell us a little bit about yourself? We know that you're currently studying for your PhD degree at National Taiwan University. Other than that, what did you do before? And you've worked with a number of NGOs in Taiwan, and you also done some research. And tell us a little bit, please.
Sometime after I graduated from the university as a political science major, I met my husband, who is a Bangladeshi, and who has been a social activist.
Oh, okay.
And that was the time during the late 1990s and the first half of the 2000s. Taiwan was campaigning for its membership in the World Health Organization, which is a specialized agency in the United Nations. And because of our background, we were invited to participate in this campaign and do some lobbying in cooperation with the Ministry of Health and Foreign Ministry and a couple of civil societies. Initially, we did some lobbying internationally, and later we changed the strategy. We thought that it might take a stronger effect if we try to focus on selected countries in Europe. So we started promoting the relationship between Taiwan and a few European countries that share something in common with the Taiwanese. So we started from nothing because, Taiwan has been isolated for many years over the past decades. And we knew literally nobody in Europe, so my husband and I tried to knock every door of the government agencies, of the parliaments, and of the health institutions, of the universities. So we try to roll up this momentum to gather support in these European countries to support Taiwan's appeal to participate internationally. So we did well. Okay. And then eventually we asked ourselves if we could do something positive to boost the relationship between Taiwan and Europe, why not we do something between Taiwan and Bangladesh, which we have a stronger support of. Okay. So this is the start of our teamwork.
Good. And we know, like you said, your husband is originally from Bangladesh.
Yes.
And other than that, what were the reasons for you to get involved in terms of your research and your work, subsequent work, on improving the relations between Taiwan and Bangladesh?
Yes. A few people in Taiwan know about Bangladesh other than the Bengal tigers or the flood when it shows on the TV news. Usually what we hear about Bangladesh is disastrous. Okay. So before that, I would like to introduce a little bit about Bangladesh.
Please.
It is a country located in South Asia and on the northeast part of Indian subcontinent. And as you said in the beginning of the show, that it is densely populated, it is very poor. Those are correct information. However, except their poor economy, there is something noteworthy that I find attractive and that encouraged me to do something good that I think will benefit not only Bangladesh and Taiwan. The people on Bangladesh, which means the land of Bengals, are very proud of their literature and their language, which is Bangla. The very famous poet Rabindranath Tagore, as we all know, he himself is Bangla speaking. He was from that area. And the works that he wrote became eventually the national anthem of 3 countries in South Asia, India, Bangladesh, and Sri Lanka. So you can see how proud they are of their culture and of their literature, of their history, and their mother tongue. So back in the 1950s, when Bangladesh then was East Pakistan, they were forbidden to speak their mother tongue Bangla. You could imagine how mad they were. So a lot of students and intellects began protesting to fight for their right to speak their mother tongue. But unfortunately, students were shot and killed by the police. And this eventually turned out to be the beginning of the dependence for Bangladesh in 1971. So you can see that how important the language or the literature in Bangladesh is. And this also left a legacy to the world because the United Nations has learned a lesson from the struggle of Bangladeshis to fight for mother language. They actually declared the day on February 21st to be the International Mother Language Day. That is the day that every country in the United Nations system will celebrate.
All right, the mother tongue.
Yes,
right.
the mother tongue. So you can say that although it is an economically poor country, I think that culturally they are very active and intellectually they are quite strong. Even small children will write poetry.
What is your current research focus on, Bangladesh? Is it on the poverty condition in the country, or is it on the literature like you mentioned? What is your research focus?
Well, the research that I focus is concerned about public health and microcredit. I'm not sure if our audience is aware of how microcredit works.
Well, let us know.
Well, microcredit, as it literally means small credit or small amount of loan that is given to the very poor people who cannot afford collateral or guarantee. But with this little money, if they have the access to credit, they may be able to engage in some income-generating activities. In the case of Bangladesh, what the poor people did with the small loans include raising chicken, raising milk cow, cattle, husking rice, or running small businesses. This model of microcredit has been very successful in Bangladesh. And then this model has been introduced and replicated worldwide, even in the most developed countries like United States.
All right. We also understand that you have done some translation work.
Yes.
Including translating the book, Banker to the Poor.
Yes.
Can you tell us a little bit about it? You also help in terms of making a documentary, featuring the Nobel Peace Prize, laureate. And then tell us a little bit about that work.
Well, I met Professor Muhammad Yunus, which is the Nobel Peace Laureate, as you mentioned. I actually met him several years before he was awarded the Peace Prize. I went to Bangladesh to attend a conference on the Microcredit Summit in the Asia-Pacific region. I didn't understand the scale of practice in Asia-Pacific, in the world until then. So I was amazed that so many people are trying to eradicate poverty with this tool, which works like magic. Microcredit. So Taiwanese people should know about it. We may or may not do microcredit here, but at least we should know what is going on outside Taiwan.
Based on your research and observation, do you think Taiwan is ready for some type of microcredit institution?
Well, there have been some efforts before we came to know about microcredit, and there have been efforts since this microcredit concept became popular. I actually tried to introduce this idea and try to run a similar program in Taiwan. But later I found out that this is not something that I'm good at. I feel that for two reasons I do not engage in microcredit programs. Number one is that after several years of practice, Professor Yunus himself admitted that microcredit alone cannot eradicate poverty. So we need other social tools like health and education. And because of the experience working for the WHO membership, I got in touch with many public health issues. So I think that public health has more elements, and it is more down to earth, more basic to human needs. So I thought that I should go a little upstream to work on the root cause of poverty. And public health is not only about healthcare or medicine. It is about water and sanitation.
It's like about basic human rights.
Yes. Vaccination and disease prevention and health promotion. And it also covers policies that can be very effective at a large scale. So I thought that politicians can change the world, certainly. Economists like Professor Yunus can also change the world. But to do public health, maybe I could also make some difference.
All right. That's why you're a doctoral student in the Institute of Health Policy and Management. Good. We need to take the first break on our program. We'll be right back. Welcome back to the second segment of today's program here on Taiwan Outlook. I'm your host, Ray Guo. We will continue our discussion with Ms. Mayeesha Tseng, who's currently a PhD candidate in the Institute of Health Policy and Management at the National Taiwan University. Mayeesha, if I may start off the second part of the program today by asking you about your beautiful blouse that you're wearing today. Can you tell us a little bit, is this a textile product that was made in Bangladesh?
Oh, yes, indeed. Thank you for paying attention to this beautiful piece, which I like very much. This is called futua. Futua. It's part of the traditional female costume in Bangladesh. But usually this type of dress is used by foreigners because more traditionally the women there, not only in Bangladesh but in South Asia, wear saris, as everybody knows, and also three-piece, which is a combination of trousers, a pair of trousers, and a blouse and a scarf.
All right. So it's one of those traditional types of dresses for women.
This is a tradition that Indian or Bangladeshi women stick to because they find these materials always made of cottons, very comfortable and easy to wash and easy to dry, and they are not tight-fitting and uncomfortable. So this is why we will see that while men's attire has been westernized, women still stick to the tradition. And it is contagious. Women visitors who go to Bangladesh or India will also like to wear things like that. And as a researcher, you need to travel everywhere and you wash your clothes every day, right? So this is very easy and very handy.
Okay, good. Well, let's get back on the subject of Bangladesh. You have been traveling and visiting to Bangladesh for over 2 decades. And can you tell us a little bit? We understand the conditions of the country have improved in recent years. Can you tell us a little bit about your first impression when you got to Bangladesh in the 1990s, and what are some of the major changes that you have witnessed in the last 2 decades? Please.
Yes, I was misguided by the news report that in the 1990s, of course, that Bangladesh is always flooded right? So I was imagining that maybe when I was landing in Bangladesh, I would be landing in a huge body of water, and maybe there was no place for passengers to sit. Actually, there was one news report that wrote like that. But when I actually landed there, I found, of course, there was no water, and it was a very simple airplane. Everybody had to walk down the airplane like the VIP because they had no modern airport. They used no aero bridges, so you just walked out of the aircraft yourself, and you walked a long way in the middle of nothing, and just to pass a desk, which is the immigration. Okay, at that time the roads were very free, and there was, of course, no supermarket. In the 1990s, you expect to see some big shops, right? But it was not there. No department store, no cake shop, no nothing, just huge area. I only saw very few buses. So, but you knew that the country was poor, but you also find it a nice and easy place there to live, and the air was quite fresh. But over the years, especially now in the recent 10 years, you will see that although the Bangladesh is developing and its economy grows very fast, what you see today is that somehow you see more beggars on the street. And of course, the big shops like the shopping malls and coffee shops, fast food restaurants and supermarkets are bustling. And then there were so many roads, so many cars on the road. But if you do not own a car, you have no right to road. Every vehicle, every kind of vehicle was honking and rushing each other. So it became like any big city in the world, and it became so unfriendly to people, especially those who are poor. And you will not only see more beggars, you also see a different type of people who are not city dwellers, but climate change refugees. Because of climate change, many people who lost their means of livelihood have to go to the big cities to try their luck. So although you see the development of this country, it is quite unbalanced.
Okay, and you also see the deterioration of the gap between the haves and the have-nots.
Indeed.
There's a widening gap between people who are wealthy, well-off, and people who still have nothing. Because according to the latest numbers that we see, a lot of people still live for $2 or less a day in Bangladesh. And do you see any prospects of that socioeconomic condition improving in the coming years, anytime soon?
Well, it is hard to say. The world, you don't even have to mention the poor country where the policy tools are quite weak to regulate or to provide the safety net. We are all exposed to the capitalism, to the market tools. So those people, I think that after the economic growth, they become more vulnerable, and they are more prone to the disasters. Within the country, we see that these people are the victims. But if we look at the global scale, we look at the global scale, it is the poor countries who are suffering and who are paying the cost for
globalization.
For globalization.
All right.
Once I went to an ice cream shop in a very hot day. I came out without buying anything because I found that the ice cream was too expensive to me.
Okay, how much did you remember a scoop was? A scoop of ice cream?
I don't remember how much it was, but I came out in a shock. I was thinking, how could the most people in Bangladesh afford this?
People cannot.
Then I asked one of my friends. They say, do you think the market is for the poor people? No, they are for the rich.
All right. And of all the trips that you have made to Bangladesh, was there any particular one that's most memorable because of the people you met or the places that you visit, or including what you just mentioned, your trip to the ice cream shop. Was there anything that's memorable to you?
Yes, the most memorable trip that I ever had in Bangladesh was in 2009.
Okay.
That was the year I was preparing to go to the doctoral program.
Okay.
And then before that, my husband and I decided to have a comprehensive exposure tour in Bangladesh to understand our field, because that time we already had a plan that I would do public health and my husband would do education. But before we get serious in this work, we must understand, rather than just staying in the capital and talk to the rich people and see the beggars every day, it may be a different picture outside the capital, Dhaka. So we traveled to many remote areas. One of the places that I visited, I still remember very vividly. That is a place. It is like an island, an isolated island on a river. Bangladesh is a riverine country.
Yes.
And the water system is very huge and very complicated. I remember that to visit one health post and open sky school, first we had to travel 3 hours on a boat, crisscrossing the branches. And after that, we reached the island they call Chaw, and we visited. We landed in the island, and we had to walk in the sand because that was a river deposit land.
All right.
So it was all sandy. So when we arrived there, it was in the middle of the day, and we had to walk in the sand, on the sand, for about 2 hours before we reached the health post and the open sky school. Every step that I made, I found out that I felt that the sand is going away. At one side, I felt like myself, an anthropologist exploring the unknown boundaries. On the other hand, I also felt that this kind of place, although many poor people reside, is more unstable than the desert, because these are very this can be affected by a storm or by
climate changes.
by climate changes. So what you visit this year may not be
around.
there.
Yes.
Yeah, next time you go. So every time I want to visit the same villages, I may not be able to find them. Even find the people that I came across.
All right. Let me ask you, you were there in 2013 for 3 months.
Yeah.
What did you do there?
Well, I went there with a specific purpose, that is to collect data for my doctoral dissertation. And then...
So that was the start of the research?
Yeah.
All right.
Yeah.
And then what was your research subject at the time?
Well, as we have been saying about the inequalities, right? I want to explore the health inequalities among the haves and have-nots. This was my assumption before going there. But when I went there, I found out that my assumption was wrong.
The story was very different.
Yeah,
yes.
I actually compared two different types of hospitals. One type of hospital is a public hospital run by the government. Another type of hospital is run by microcredit institutions. Because microcredit started working with the poor, they always say that they identify the poorest of the poor. So I imagine that the patients in the hospital run by the microcredit institutions will be poorer than those who go to other types of hospital. Guess what?
Guess what? I'm going to ask you to hold that thought, because we need to take another break on our program. When we come back, we'll find out what Mayeesha has found out in her research. I'll see you in just a few minutes. Welcome back to today's program here on Taiwan Outlook. I'm your host, Rui Guo. We'll continue our conversation with Ms. Mayeesha Tseng, who's currently a doctoral candidate in the Institute of Health Policy and Management of the National Taiwan University. Mayeesha, my apologies for interrupting you earlier in the program.
No problem.
But let's find out, what did your research told you?
Yeah, quite contrary to my assumptions. I found out that, interestingly, microcredit institutions who are supposed to target the poorest are not serving as many poor patients as the public hospitals do.
Okay.
So it actually confirms the principle in public health the area, which is that health and education are the basic things that government should provide. You are not to leave these two services to other sectors, either to the NGO sector or to the microcredit sectors, because there will always be some loopholes that you cannot catch.
Okay, so in the sense that these so-called private medical institutions may still want to generate a profit or generate some revenue to make itself, self-sufficient.
Yeah. Somehow they have to do it because running hospitals are very costly.
Yes.
It's very huge investment, and without this public revenue or without this revenue, you are not able to sustain yourself. So you get yourself into a big trouble, even if you started well.
Yeah. Okay, and let's talk about another program that you have been, advocating in the last few years, which is called Writing is Happiness. And this is a program that involves handicapped students. Can you tell us a little bit about the background about the program and what does the program aim to achieve?
Yeah, I have been saying that health and education are the basic needs or the basic rights of human that can enhance them they can enhance their ability to get themselves out of poverty.
Yes.
So while I do public health, my husband is focusing on the part of education. So he has created an organization called RISE, Research Initiative for Social Empowerment. And the first project of RISE is Writing is Happiness. In Bangladesh, the primary school dropout rate is close to 50%.
Really?
Yes. So with this fact, how can you expect a society to develop? And those who drop out from the primary school are the kids of the poor families. But in addition to this, among these poor families, a more marginalized section is the disabled children, the handicapped children who are disregarded by their own family members, not to say the society. However, you still find a few of these disabled children who struggle to continue their schooling despite all odds and the isolation. So these are the children that we selected to help. If all these personal and societal challenges and difficulties, they can stick to what they want. These children might have some extraordinary potentials or capabilities much greater than their ordinary normal peer. And we have a long-term goal for these children. So we first invited them to join this Writing is Happiness program. By this, we first provide a monthly stipend to support their schooling on one condition only, that is they must write. So they can write on any subject, anything. And they can write one sentence, they can write one page, but they must write every day. With this, we are trying to to create a channel for them to communicate with the world, with the society. So through writing, they can express their anger, express their agony. They can also think positively. They can sing, they can draw, they can write poetry. They can dream, they can hope, they can even argue. This is what we found in their writings. And we found that this is a mutually enhancing program. While we observe their growth and their changes, we are getting more hope among these children who are originally deemed helpless, useless to the society. Yes.
Right.
So I would like to share two letters.
What are some of the things they write about? Please.
Yes. This first letter is written by a girl who is an 8th grader. She is born with two deformed hands, non-functional, and she has to write with her right foot. Okay. And her father is a locksmith.
All right.
Okay, they live hand to mouth. So one day she pointed out a very serious social problem in Bangladesh, which is child marriage. She wrote, one of my friends was forced to marry. She is only 12 years old. She begged her parents to help her study further to become a nurse. Her husband, a 25-year-old, was chosen by her father. When my friend cried for help to change her father's mind, the father, rather than threatening her, begged her, if you wouldn't marry this young man right away, I would commit suicide. This is a blunt lie. The father will not commit suicide. The girl will commit suicide. But in Bangladesh, marriage under 18 years old is illegal, and you may be subject to 3 to 6 years in prison.
Okay.
So you can see that she is socially aware. She knows the problem, right? And she identifies it. That means she has her own opinion. She doesn't follow the tradition.
Okay.
And the second letter is very positive, and it echoed what I just said about Bangladesh's love for poetry, for their literature. Here in this letter, she wrote a very beautiful poem. It started like, I want to shine brightly in 7 wonderful colors of the rainbow.
Okay.
I want to be the golden paddy during harvest. I want to be the serene smile on the faces of the farmers. I want to be the essence of rose. But truly, I don't want to be anything like that. I want a life full of their qualities and to be beneficial to others.
Okay.
See how hopeful it is and how beautiful.
That's very admirable.
Yes, if you properly motivate these children, they can be the leader of the society.
Of course. And do you have any plans to maybe publish some of these letters in a collective volume in the future? Or do you intend to send them to potential sponsors to get some feedback?
Well, publishing books based on their letters is one of the options, but we think that there are other things that we can do to support them.
Please.
So writing is happiness is just a short-term goal of RISE. Because first we not only want to support the education of the children, we want to identify the potential youth leaders.
Okay.
So because these are the seed that can help change the mind of other children of a similar situation, and they may also change the mind of the society that what you think hopeless may not be hopeless. It may be otherwise.
Okay. Right.
It may bring a positive power to the society. So this is the phase 1. We identify the children who have strong willpower.
Or motivated to get involved.
Motivated.
Yes.
So the second phase is to throw them a challenge. We dare them that now you are a proud RISE champion. So what we want you to do is that you are going to be a schoolmaster of a Friday school.
All right.
So what you will do is that you know that beside you there are other children in your village who do not have access to education. So we want you to run a class only once on Friday. That is a holiday in Islamic society. So you run a Friday school for 1 hour or 2 hours. You gather the children who do not go to school and you teach them. So you give us your plan, how you plan to do, and you may want to distribute some candies or biscuits to to the children who may come to the class hungry,
exactly. Yes.
and who may want to come and to be with their peers. So you teach them what you have learned in the school. So you not only empower yourself, you are also empowering others, and you are bringing hope to them. You can see that if I have no hands, I have only one foot to write, I can teach you what else you cannot do.
Okay, all right.
So this is the second phase we want to do with the
Currently,
rice
you only have
championship.
2 phases planned, right?
Yeah, we have more.
Okay, well, what are some of the things that you're thinking of doing to make the Writing is Happiness program different from others? You know, because others may want to send it, you know, publish a book, for example, or send letters to sponsors for more, you know, sponsorship. I mean, you want this to be different. How so?
Yeah, we want to stir up the movement of self-empowerment.
Okay.
Within the community, within the children, within the families, within the village. So after these Friday schools are start running, we want these children and their family to tell us what they can do and what they need to start generating some income to prove the livelihood of their families.
That's
so
terrific.
We now are currently supporting them financially from our own pocket. We do wish to expand this program.
The scale?
Expand the scale by raising a fund of $100 million so that we can start a revolving fund to run the family development program, and then eventually to create a children's university by 2025.
All right, keep our fingers crossed that your dream will come true very soon. All right, we need to take the final break on our program. We'll be right back. Welcome back to the final part of today's program here on Taiwan Outlook. I'm your host, Wu Ruiguo. We will continue and wrap up this fascinating conversation with Ms. Mayeesha Tseng, who is currently a doctoral candidate in the Institute of Health Policy and Management at the National Taiwan University. Mayeesha, we were talking about rice. We were talking about the Writing is Happiness, program. And you mentioned at the end of the segment last time is you want to raise $100 million to continue the Writing is Happiness program. That is a very ambitious number. And then how do you plan to get people involved, interested, and open up their pocketbooks and make the contribution that you need?
Well, we want to raise this big amount of money because except Writing is Happiness, Friday School, we have 2 other big programs
that
targets.
Targets.
Number 1 is a family development fund. We want to engage the poor families of the rice children to do some income generating activities without an interest. That is different from the microcredit loan. And the second thing is that eventually we plan to establish a children's university by 2025. This children's university will will recruit children from 192 children from each district in Bangladesh. We want to have the talents and we want to have the intention of these children who want to develop the vocational skills. So this is the vocational training school, because as we are willing to support the rice children's education, not everyone will go up to the university level or the graduate school level. Some may want to work. So we want to develop them into the environmentally conscious citizen of Bangladesh. So we want to train them to do agriculture, to do some business, and to do other economic activities that will keep them in the place rather than going to other big cities to flock there and to be another member in the slums.
All right, so that's very similar to the traditional Chinese concept of instead of giving the poor people a fish, you teach them how to fish. You give them the skills they need to be competitive in the future.
And in the meantime, we want to conduct the research. That is the part where the Taiwanese and Bangladesh can work together. Because we are running these many programs at the same time. We need to evaluate them. So Bangladesh has a great potential for researchers of all disciplines, health and education and science and agriculture and economics. So everybody is welcome to come and join us. So we can form a research team and then we can do research in these communities. This can be a very good control and experiment program, and then it will open the eyes of many young Taiwanese that the things that they are accustomed to may be different in another part of the world.
All right. And before we end the program today, then Mayeesha, we're going to talk a little bit about the state of bilateral relations, between Taiwan and Bangladesh. We know, of course, there is, no diplomatic relationship between the two countries. And then there's probably very little, little that people in Taiwan know about Bangladesh. A lot of people would know about Bangladesh, whether it's, in the news about some natural disaster or in the back of their shirt, maybe the garment was made in Bangladesh. But can you give us a taste, an exposure of, the bilateral relations between the two sides? For example, are the NGOs in the two countries very active? Or are there, educational exchange programs for students of different ages? Or are there cultural or literature, experiments that are taking place, between the two sides? Please share with us.
Bangladesh has probably the highest density of NGOs in the world, because they are, as I said, that the intellects, they are very active. They are always doing experiments because their land is huge and the population is also very big. So the educated people always want to do something for the society. So they started different kinds of experiments, and they indeed worked with the international partners. But so far, I do not see something substantial happening between NGOs or between Taiwan and Bangladesh. However, there are already some Taiwanese businessmen who are doing the import and export business. So I think that the NGOs in Taiwan might find Bangladesh a very interesting and challenging place to work. Yeah.
And then what are some of the, among the younger generations, what are some of the things, when you mention the word Bangladesh to them, what are some of the things they think about? Those, younger people in Taiwan may be interested in volunteering their time, experiences, in helping people in another part of the world, Bangladesh included. What would be some of the things that you can tell them about Bangladesh if they are thinking of, whether through your program or through other NGOs to get involved with the work and the research in Bangladesh?
Nowadays, young people are very interested to go to India, right? And to do voluntary work. The same thing that you can do in Bangladesh. Bangladesh has all kinds of subjects, and they have on the street of Bangladesh you can see the vehicles of international agencies like UN, WHO, World Bank, and you can see that this place, if you are in Bangladesh, you can see a small world there. And all kinds of subjects and all kinds of researchers, all kinds of businesses are taking place there. So if you want to have a connection to the world, Bangladesh is a very good start point.
Okay. And before we end the program today, Mayeesha, I'm going to ask you something up close and personal. We understand that you are now finishing your doctoral, studies at the National Taiwan University. Tell us a little bit about your dissertation focus. What would be some of the things that you have, already, discovered in your doctoral research?
Well, as I said, that one of the findings is that the social programs, so-called social programs run by the microcredit institutions, are in fact marginalizing the poorest from the rest of the poor. So what I find is that the real beneficiaries are the second poorest. They are not the poorest. So there is only a small segment of the population that needs other types of intervention. So microcredit has already proven that it is not effective in this segment. So this is what I want to tell the people who are interested in microcredit, that you need to understand there is a limitation of microcredit, and you should think beyond microcredit. Like you should think beyond your physical disabilities. You always have a potential to do something, and you always have there is always a gap that you need to fill only if you keep your eyes open.
All right. And based on the experiences that we had in Taiwan in terms of socio-economic development, do you think there may be some lessons for people in Bangladesh to learn from the experience in Taiwan? For example, our emphasis on education, our emphasis, later on in the economic development on protection of the environment. Are there some lessons you think can be commonly shared between the two sides?
Well, yes, I think that there are, of course, a lot of experiences in Taiwan that can be shared with our friends in Bangladesh. I think that education is the key that has changed Taiwan's economic status from a developing to a developed country. Yes, but now the education in Bangladesh is and the economy in Bangladesh is very different. It is not like what it was 20 or 30 years ago. While Bangladesh's government is encouraging the girls to go to school, they even subsidize the girls. I mean, they give them cash reward for the parents to go to school. But they still fail. Why? Because number one, the parents are too poor. So they have to send their children to work. And then, for example, there is not enough infrastructure. They do not have access to water. So they will send their children to fetch water. And the water source is far away from their home. So the children, instead of going to school, they have to go to the river or go to the tube well. And what kind of children are going there? The girls. So even if you provide some incentives, you cannot ignore the larger picture that they are exposed to.
All right, finally, Mayeesha, let me ask you, what's on the agenda for you and your husband, in addition to the RISE, organization, and also you about to complete your, doctoral degree at NTU. What's next on the agenda for you? Do you want to teach or continue research, or continue to get involved with RISE?
Well, research is something that I will continuously do. Along with this social experiment that my husband and I are doing. You can always observe the seed that you sow grow.
Of course.
Sometimes they may fail, but to our experience, so far we have not failed because we see the children grow. You only have to have patience, and you do not dictate. You do not tell them what to do. You tell them what they are thinking. You ask them what they want, and your own resources, you try to match them. This is how you are unlikely to fail. So far, we are happy with our result. We see the changes among the children who even wrote to us that they now know why we want them to write in the first place. And they also feel proud. Can you imagine a disabled, neglected child feeling proud of herself?
Of course, that is quite an accomplishment. Certainly want to wish you and your husband all the best in the future. Thank you.
Thank you.
Thank you for watching our program today. I'll see you next time on MacroView Television. Thank you.